A subchorionic hematoma is a collection of blood between the membrane surrounding the embryo and the uterine wall. It's detected most often in the first trimester. It does therefore not prevent conception or cause infertility, but rather it's a complication that can threaten then the continuation of the pregnancy. This is often a marker of deeper problems like vascular fragility, inflammation, poor implantation, environment, or clotting imbalances, and potentially linked to autoimmunity, high homocysteine, MTHFR mutations, nutrient deficiencies. Then we have endometrial inflammation, chronic infections, hormonal imbalances, or underlying stress and trauma. And if you experience them over and over again, then the question is, why is the endometrial environment so prone to bleeding and instability? Are there micronutrient gaps, blood sugar imbalances, connective tissue issues, over-thin lining maybe from IVF medications, then autoimmune factors or chronic stress that are undermining the uterine soil? Western medicine typically monitors or manages just the symptoms unless bleeding becomes severe. We might have to optimize micronutrient status, vitamin C, K2, magnesium, omega-3s, then also address possible clotting dysfunctions or immune dysfunctions. If that happens over and over again, get a comprehensive coagulation and clotting panel. They can reveal both classic and subtle clotting disorders, which are often missed. Run a full thyroid panel because thyroid autoimmunity and even mild dysfunction can radically impact your miscarriage risk and vascular fragility. Do test the antibodies. This is extremely important here. Also check vitamin D, B12, folate, then magnesium, then we have zinc, ferritin, copper, vitamin C, and also get the MTHFR mutation gene test. Evaluate blood sugar and insulin resistance. Look at inflammatory markers like CRP and ESR, and ideally cytokine or TNF-alpha panels. Screen for endometrial pathogens like chronic endometritis or urea plasma or mycoplasma. And if you suspect autoimmune issues, check for ANA, ENA, rheumatoid factor, and broader panels depending on symptoms like celiac antibodies. Yes, gluten sensitivity is also plausible. I know it's extensive, but I hope it helps.